To health now, and consultants are going on strike today. Doctors Amir and Anisha join me now. So Anisha, how might this affect an appointment, potentially one that people have been waiting for some time as well?
Yeah, so we know that consultants are striking today and tomorrow, and this is to try and reverse the 35% pay erosion that they've seen over the last 14 years. So how is that going to affect us? We know that Christmas Day-like services will run today, so emergency care is there. And don't fret, so please use healthcare as you would. So call 999 if you have a life-threatening problem, 111 for any other health conditions, and remember, GP surgeries and pharmacies are open. If you've got an outpatient appointment, if it's been cancelled already, you should have heard and it should have been rescheduled. If you haven't heard, then please go and attend your appointment. The fear is now that obviously by the weekend we've now had news that up to 1 million appointments will be operations will be cancelled. So what we need to do is get the government negotiating with them, because we know the BMA have announced further strikes in October, the 2nd to the 4th. And also with regard to the 19th and 20th, which is already going ahead.
OK, yes, as you say, the talks have to happen for all of our sakes. With news that some cancer waiting time appointments are set to be dropped in England, our doctors are going to give us a head-to-toe rundown of the signs and symptoms we should be looking out for. Starting at the top, I guess. Amir, will we start with the lungs then?
Morning. Yes, let's start with the lungs. So lung cancer is one of the most common types of cancer, usually affects people who smoke, but not always. So it's good for everyone to be aware of the signs and symptoms. The first thing is quite obvious. If you're coughing up blood, you should go and see your GP or clinician about that. But the key thing here to remember, the magic number is 3 weeks. So if you've got any of the following signs or symptoms for 3 weeks or more, so an unexplained cough for 3 weeks or more, that unexplained kind of chest or shoulder pain that isn't obviously your heart or your muscles, and you can move your arms around, but it still hurts, get that checked out. A change in your voice or hoarseness of voice for 3 weeks or more, get that checked out. If your glands in your neck or your shoulder area have gone up and they've been there for 3 weeks or more, get that checked out as well. And if you've got a chronic lung condition due to smoking, like emphysema or bronchitis, and it suddenly gets worse, go and see someone about that as well. It might not be cancer, but it's always worth getting checked.
Absolutely. 3 weeks. OK, that is the time limit. Anisha, OK, breasts.
Absolutely. So breast is next. And what we need to remember, as we do with change and check every year, is that we should be checking our breasts regularly. So once a month, put it in your diary. You can arrange for a text reminder. And what we need to do is make sure we're doing it around the same time each month. So either the first of the month or after your period when your breasts are less lumpy. What's really, really important when examining your breast is you must look first and feel. So look in front of a mirror, standing up with your hands by your sides and then your hands behind your head. Now then, when you want to examine, do it somewhere where you're comfortable. So in the shower or lying down, and again, with your hands behind your head. And you're going to use your fingertips, the pads of your fingertips, to feel around the breast area here. You're going to feel lightly, and then you're going to feel with firmer pressure. Don't forget under the collarbone, and don't forget you're under your armpit. That's really, really important. And what you're looking for obviously lumps and swellings. You're looking for nipple changes. So is it become inverted? Have you got discharge? Is there any rash? You're looking at the skin. Is there a bit of thickening of the skin or a rash or any dimpling? And you're going to also be thinking, have I got any unusual pain? Now, 1 in 7 women will get breast cancer. So it's so important that we get that message out there for people to be checking and knowing you're normal, because if you don't know what your normal is, how will you know when there's a problem?
Exactly. So you have to do it that once a month thing, so you know you're normal. That's exactly the point. Yeah. OK. Thank you. Very good. Will we go to the stomach now, Amir? What do we need to know?
Yeah, so this is our stomach and our food pipe, our esophagus. So if food is getting stuck or it's painful to swallow, get that checked. If you've got new onset indigestion and you're 55 or over, you must get that checked out as well. If you've got abdominal pain or back pain with weight loss, get that checked. That could be your pancreas. If you've got any kind of new lumps in your tummy, get that checked. Persistent vomiting needs checking as well. And this sounds a bit odd and a bit unusual, but if you're walking around and you've got no pain whatsoever, but somebody tells you, oh, you look a bit yellow, get that checked as well. Painless jaundice must be checked.
Right, OK. Gosh, there's a list here, isn't there?
Sorry, we look like we're worrying you now,
No,
Christine.
I'm literally taking in every single thing you're saying and trying to remember it all. The bowel, Anisha, I know you are very passionate about us all being very aware of our bowel health and our poo.
Exactly. We should not be embarrassed about checking our poo. I've had bowel cancer at 39. It doesn't discriminate. So what's excellent news is there has been news out this morning. There was nice guidance about a month ago that came out that is asking GP practices to use the DIY poo test called a FIT test, first line on all patients that present with bowel cancer, to try and reduce the number of people being referred directly to colonoscopy immediately, to try and reduce the waiting times, because we've got long wait times for these tests. These poo tests are excellent at detecting microscopic blood in your poo. And it's a simple poo test. You have a little stick, get a trace of poo on it, send it off to the lab, it goes off, you'll get the results back in a week, and it will tell you if there's a little bit of blood in your poo. Please don't worry, not every positive poo test that comes back for blood is cancer, but you then do need to go and have a colonoscopy. And as GPs in my area, for example, at the moment, we are already doing this. Everyone gets a poo test, a FIT test first, then if positive, onto colonoscopy. But this needs to be rolled out through England and Wales to reduce that time.
And this is something you can do at home, obviously.
Absolutely.
So that
and
takes
it's
away
really
all of that kind of potential sort of feelings, embarrassment, anything that you might be feeling that you shouldn't feel, but you might, and that you can do that at home. That's amazing.
It is amazing. And just remember the signs and symptoms. I'm quickly go through. As part of the No Buts campaign, we had the acronym BOW. B stands for blood in your poo or on the tissue. O is for obvious change in bowel habits for more than 3 weeks. So that could be constipation, diarrhoea, frequency, urgency, even a change in your poo shape. W is for weight loss that's unexplained. E is for extreme tiredness. And then we've got L at the end for lump in the tummy or tummy pain.
OK, all of those things. And keep that list nearby.
Absolutely.
Yeah, completely. What about our skin, Amir? There's been quite a few sort of discussions in the press. Chris Evans, just the past couple of days, about skin cancer. We all have to be aware for any kind of little change.
Yes, absolutely. So any lesion on your skin that isn't healing over, get that looked at. But if you've got a coloured or pigmented lesion or a mole, you've got to apply the A, B, C, D, E criteria. So pick a mole or pick a coloured lesion. A, is it asymmetrical? That's worrying. Look at the border. If it's got an irregular border, that's worrying. Look at the C, the colour, whether it's a different colour, it's not the same colour all the way through, that's worrying. D is for diameter. If it's more than 0.5 centimetre, and particularly if it's growing, get that checked out. And E, evolving over time. So if it's bled, if it's become itchy, if it's changed in any way, get that checked. Remember, A, B, C, D, E, when it comes to coloured lesions, we're looking at the risk of melanoma there. That's what Chris Evans has been diagnosed with, and that really needs looking at urgently.
Urgently, exactly. And it can be the tiniest little mole as well, can you? It doesn't necessarily have to be a big mole by any standard. Thank you. We're talking breakfast now. We're all intrigued as to what a doctor eats for their breakfast.
Absolutely. So,
Are you going to tell me
Amir,
something ridiculously healthy, isn't it?
well, this is Amir's breakfast here. Amir, do you want to just tell us quickly what's in your pot?
Yeah, I have this every morning. Porridge, some nuts, particularly walnuts, banana, peanut butter and cinnamon, full of antioxidants, omega-3 fatty acids, slow-release carbs, keeps me going until lunchtime because I don't have time to snack. Even though patients do bring me lots of chocolates, I give them to reception, I eat my breakfast and get through to lunch.
That's a good one, yeah.
And I've got, very similar to me, but I'm a mum on the move, so I don't often have time like you, Christine. So this is an idea. Put your breakfast in a jar overnight, frozen fruit layered with yoghurt, chia seeds, pumpkin seeds, sunflower seeds, or I stick in my bag a couple of boiled eggs, some oat cakes. I can eat on the go. Again, will keep me full for longer, and all the nutrition that Amir has said as well.
It's all in there. Right, there you have it. That's what a doctor eats for their breakfast. Right. Thank you very much, Anisha. Thank you, Amir. We'll catch up soon.
You.